Welcome to A Healthier Future with Patti Payne. I'm longtime broadcaster Patti Payne, and the Pacific Northwest is my home. It's a beautiful, thriving region, and I love it here. I'm partnering with Providence on this series to talk about what it's going to take to secure a healthy future for generations to come. This is a great opportunity for all of us, and joining me today is Beth Schenk. She's Providence's Chief Environmental Stewardship Officer, and that's quite a title. We're going to discuss how a healthy planet is essential for healthy communities. Welcome, Beth. I would like to start by asking why a healthcare organization like Providence is so active on the climate issue.
Well, thank you, Patti. It's my pleasure to join you today. I'm excited to talk with you. There are a lot of different reasons why, first of all, healthcare should be interested in climate and why Providence is. First off, Providence has a long history of commitment to being concerned about our natural resources. This is interesting through the history of both the Sisters of Providence and the Sisters of St. Joseph. In their documents, they refer to the natural resources that we have been blessed with in the communities, and yet have recognized that we have not always been wise in our use of those resources. So they ask us to do better with our stewardship and also to be good models of stewardship for others across the nation and beyond. But more to the point, healthcare is actually polluting. So, most industries, businesses, homes are, but healthcare makes up 8.5% of our nation's annual greenhouse gases. So we take that seriously, as we don't want to be part of the problem, because on the other end of that pollution is the harm that causes to health. So we're quite concerned about how climate change, how toxic chemicals, how biodiversity loss, and other environmental issues impact health negatively. And so we want to be on both ends of that solution, decreasing our contribution as well as helping to solve some of those problems for health.
It's interesting how those two are linked. I don't usually think about that as a link, but can you expound a little more about how the climate crisis affects health directly?
There are many, many ways. Some are more obvious than others. For instance, high temperatures. In the Pacific Northwest, even we have had high temperatures. You might remember in 2021 when Portland, Oregon saw 116 degrees, Olympia, Washington saw 108 degrees, Seattle was well over 100, and this lasted for a few days. And we're not built for that in the Pacific Northwest. Our buildings aren't ready for that. People aren't ready for that. A lot of people, especially then, I think this has changed a little bit, didn't have air conditioning in their homes because we don't really need it. And so hundreds of people died in the Northwest from Canada to the California border that wouldn't have had it not been so hot. That's a direct example. Another direct example is smoke. So when we're inundated with wildfire smoke, as we are more frequently now in the summers because of wildfires. Wildfires are not directly because of climate change necessarily, but they're made worse by climate change because of heat and drought. That smoke is really damaging to lots and lots of different people with different diagnoses, from respiratory issues to cardiac issues to peripheral vascular disease, as well as mental health and well-being. Those are two direct examples. There are lots of indirect examples. Think about the length of time of pollination season. That leads to greater allergies because there's a longer growing season. We also have more movement of insects that can carry disease into more northern climates and higher elevations because it's warmer and they're not killed by the cold. So there's ways like that influence health. And then also there's harm to finances. So some people's businesses are damaged, their crops are damaged, their agriculture is damaged, and that has ramifications. And then, as I mentioned, the mental health aspects really are impactful everywhere, not only because heat is hard to deal with or the specific manifestations of climate change are hard to deal with, but also there's this sort of existential pain about what is happening to our world, what's happening to our planet, and how do we get through this? So there are really a lot of different ways. They're kind of regional. So, we might see different things in Anchorage, Alaska than we do in Lubbock, Texas. But along the West, a lot of what we're up against is heat and wildfires and smoke.
I'm seeing more evidence of those wildfires in wintertime as well, which is very shocking to me. So
Right.
you talk about the effect of it and what can we do about it? What can we do about it?
A common term that people might hear in climate speak basically is mitigation. And so that is to mitigate our pollution or drive down our pollution. So for this, our strategy is a framework called We Act. And that stands for things. It stands for sources of greenhouse gas pollution. First is waste, then energy and water. That's the E. The A is for agriculture/food, the whole process. The C is for chemicals, and the T is for transportation. So all of these areas, we're working across the board to decrease. So for instance, for waste, healthcare creates a lot of waste. You may know this if anyone has been in the hospital or in a clinic. We have lots of reasons for that, but we can also really reduce it. So our target by 2030 is to divert at least half of our waste away from landfill and hazardous streams. That's biohazard and sharps and hazardous waste. At least half of it we want to divert so that it's not going to these high intensity streams. For energy and water, we're working on all sorts of things to really decrease our greenhouse gases for electricity and for natural gas. And we're also decreasing our use of water because we're in such areas of drought. And we do that by energy efficiency, by replacing machinery when it's at the end of life, by purchasing renewable electricity. We're really working hard on that as well. For agriculture and food, we're working on a number of things. First of which is to decrease the carbon intensity of meals served. Now, what does that mean? Carbon is a shortcut word for greenhouse gas. And agriculture, you may have read about, or listeners may have read about, is actually a significant contributor to climate change because of the way we grow our food. It's energy intensive, it's fossil fuel intensive. We use a lot of chemicals to help the food grow, some of which are contribute to greenhouse gases. We transport the food a long way. We cook it, of course, necessarily. And then unfortunately, we waste 30 to 40% of it. So we're working on all those fronts related to food to try and have menu planning that's careful so that we can have plant forward food while still providing good, high quality protein. We are working on portion sizes so that we don't create so much waste. We're working on ways to change the menus so that, if you have leftover carrots from Monday, you can use them in a salad on Tuesday and use them in a stew on Wednesday. Things like that sort of thing. And I'm not a chef, so don't quote me on that. But to use our food resources wisely. We're also then working on waste. So we try and compost all of our food waste that's going to go out the door to keep it out of the landfill, because food waste in a landfill creates methane, which is a potent greenhouse gas that lasts a long time. And then also we work on food waste reduction on the prep side. So when the cooks and the chefs are preparing the food, they learn how to do it super efficiently. It's really kind of cool. They have a camera system that helps them observe their own behavior so that when they're chopping, let's go back to carrots again. If you're chopping a carrot, you don't take a whole inch off. You take just the little bit of the green tip that you don't want to actually serve. That really can reduce food waste significantly. And then lastly, we're working on keeping healthy and local and sustainable foods in our lineup so that we can both support our communities and keep people a little bit closer to home and what they're eating.
Interesting. And I'm not a chef either, but when I hear you say we just take a little bit of the tip of the carrot off,
Yeah.
that can even be used in stews
That's
or
true.
soups.
Yep.
Absolutely. I'd like to go back to the extreme weather events.
Okay.
Only seem to be increasing. How is Providence making sure that your staff and your facilities can care for patients through natural disasters and through these extreme weather events?
It's daunting.
That has to be a challenge.
It really is. And I would say that we are building our chops in this regard. And that's partly because in 2022, we signed up. We were one of the first health systems to sign up for the Department of Health and Human Services Climate Pledge. So this is through the federal government. And we needed to reduce our emissions, which we're working on, and also to create a resilience plan, a climate resilience plan, which we did last year in 2023. And we focused on a few areas that will get at your question, I think. So let me explain those.
Please.
One is to make sure that our buildings are going to be okay. Remember, I just was talking about that 116 degrees in Portland. One of our hospitals there, a big hospital, in that kind of heat exposure for several days, on the south facing side, their window frames and door jambs warped. It was so hot. It was twisting and warping the metal frames.
Wow.
Also, that building held onto the heat because, the hospitals, most industrial buildings are concrete and steel. They hold on to heat, significantly. And that was a difficult building then to cool and manage for our engineer there said for another 10 days. We had another hospital in Olympia that needed to shut down a unit for just a couple days. We don't want that because we need to be there when people need us, and people particularly need us during these events. So part of our resilience work is on our own buildings and readiness and capacity. But what you were asking about also was our caregivers, because, it's kind of crazy that the caregivers who are delivering care are living through the same extreme events that are making people sick. So that is a difficult challenge. We have had to evacuate a nursing home from fire in Oregon. We almost evacuated a hospital. In some of the fires in Northern California a few years back, a number of our caregivers lost their homes to fires. More recently, several of our caregivers in Montana had to evacuate their homes. That makes it hard to come into work, doesn't it? So we can't always control that, certainly, but we can help people prepare. We can help people be more aware of that. We can help managers and directors try and staff up during those times. One thing I thought was kind of cool this last summer was with some of the fires in Southern California. The Providence team had arranged for notifications to staff about road closures. So it was a live thing that on phones people could quickly look at that was meant directly to go to hospitals and clinics related to Providence. So it was more than just what's available to the public, but in ways that we can to help support that. And part of it, a big part of it, I think, is education, awareness, and preparedness. Because, as I said, the unfortunate truth is we're all living through those things. It's not just the people who have particular diagnoses. It's really all of us who live in these communities.
So true. You were talking about the buildings, many of the Providence buildings, and how they are constructed and they hold the heat. But that also means that they also hold the cold during the bad winters, correct?
Well, they're pretty well insulated. So, hospitals, just like homes, I guess, are built really for the climate they're in. So, we're in the Northwest, for instance, we're used to those climatic conditions that get down to a cold, whatever the temperature is. Different in Alaska, different in Montana, different than our coastal communities. But for more standard, sort of normal winter weather, we're well designed for those, because that's how we design the buildings, and it's required by law. You have to be ready for those climatic conditions.
But things are going to the extremes now.
Yeah,
They're designed for more normal, but the new normal is a little bit shocking.
it is, especially on the high end, and that's what it really is a lot to contend with, no question.
So what is Providence doing to lead environmental stewardship at the national level? Providence has always had a long vision. So I'm wondering how they're preparing.
Well, we have the third part of our kind of strategic plan. We call it We Share. And part of that has to do with our relationships and partnerships. So we do that through our government affairs work with the federal government and state legislatures and city councils. We also do it with a number of organizations in healthcare, like the American Hospital Association, the National Academy of Medicine, the American Medical Association, the American Nurses Association, the Department of Health and Human Services, like I was saying, the Joint Commission. So there are a group of hospitals and healthcare leaders across the country who are all trying to make progress here. And we have been fortunate enough through our leadership to be able to be at those tables and in many of those conversations. So that's really important, because we can't do this alone. We're a big outfit, but the U.S. health system is even larger, obviously. And so it helps us greatly to work with them. So, for instance, I was telling you about the Department of Health and Human Services pledge. That's really great. And that helped move about 20% of American hospitals forward. Another one that was pretty exciting this past year in 2024 was the Joint Commission. And the Joint Commission is the largest accrediting body for hospitals, and you need to be accredited in order to use Medicare and Medicaid dollars. And so we are accredited, of course, all of our hospitals, and most of our hospitals go through the Joint Commission. And so they offered for the first time a sustainable healthcare certification. It's voluntary, and we were the first large health system to achieve that for all 50. We have 54 different campuses, so for all of our campuses. And that was really great because we got to work with them closely over that planning period and through the process. So that's another example of how we want to be part of the solution, and we want to demonstrate leadership as we can. Back when I was talking about the sisters who asked us to be wise with our stewardship, and as I mentioned, they also asked us to be good models of stewardship. So we take that very seriously. We try and help. We try and tell people how we're doing things. It's not a secret. We want all of healthcare to move forward and to be successful.
What the sisters wanted and directed all those decades ago holds today and will always hold. And so, Beth, on behalf of Providence, I want to thank you so much for joining us today and for all of the efforts to care for the environment in our communities. And I want to thank our audience today for being with us. I hope you've learned a lot. I know that I have. Once again, on behalf of Providence, thank you all.